Welcome to this lecture on Nursing Foresight Leadership. My name is Dr. Daniel Pesut, and I'm a professor of nursing at the University of Minnesota School of Nursing and currently director of the Katherine J. Densford International Center for Nursing Leadership. A key question for any leader is the how can I best navigate, anticipate, and lead into the future? For some time, I have been committed to challenging people in the nursing profession to think, learn, anticipate how to navigate the future. In this lecture, I share 9 principles related to the development of nursing foresight leadership. I hope the principles challenge you to develop your foresight leadership skills and consider what your professional nursing legacy might be in terms of shaping and influencing the future of nursing and health. Specific objectives of this lecture are: discuss principles that support the development of foresight nursing leadership to inspire innovation and change to create the future of nursing. Gain insight about the impact of trends across industries to anticipate the future for nursing and health. Explore selected references and resources to advance awareness, knowledge, insight, understanding, and action to develop nursing foresight leadership skills. And finally, reflect on the contributions nurses can make to shape the future of nursing and health. Over time, I have come to believe the following principles are essential to the development of foresight leadership. Number 1, know your personal and your organization's orientation toward time. Number 2, appreciate the value of innovation and design thinking to support foresight leadership. 3, develop foresight leadership literacy skills. 4, actively monitor industry trends, forecasts, and disruptions. 5, discern logical consequences of trends using futures thinking tools and techniques. Appreciate the use of vision-based scenarios. Stimulate strategic conversations about espoused visions looking backwards from the future. And navigate change efforts with the creative power of appreciation, influence, and control. And finally, be clear and intentional about a professional nursing leadership legacy. Some years ago, I studied with Philip and Michaela Tarlow. They wrote a fascinating book referenced at the end of this presentation titled Navigating the Future, a Personal Guide to Achieving Success in the New Millennium. In this work, they note what the future holds for you depends on what you hold for the future. So as you become clearer about what you want the future to be, that future will be realized through your conscious intentions to create it. Unfortunately, many of us have become victims of what developmental psychologist Frederick Hudson calls future blindness. Hudson studies adult development and discovered many adults become future blind for the following reasons. People become future blind when they become lost and trapped in yesterday's decisions, choices, and consequences. This results in many of us becoming risk-averse. Second, some of us feel betrayed by expectations when we realize we must negotiate the expectations of our youth with the realities and experience of life. Another factor that contributes to future blindness is the fact that social systems, once protective, are destabilizing. Additionally, people today are often overwhelmed with information and decisions, and sometimes we become bewildered by change, complexity, and discontinuity. As a result, Dr. Hudson observes that many people develop a discourse of regret versus hope. It's the job of a leader to shift the nature of discourse in an organization to one of hope, inspiration, aspiration, and vision. Creating a vision of the future that touches, moves, and inspires people in an organization involves the development of foresight leadership. Foresight is the antidote to being future blind. The development of foresight presupposes that leaders develop actively and master the art and science of anticipation that is associated with the development of future literacy skills. There are several resources available to help leaders activate and develop their foresight leadership skills. For example, click on the hyperlink in this slide and learn what the United Nations education and scientific organizations are doing to help people around the world develop a future thinking orientation. Check out the references and resources at the end of this lecture to learn more about future literacy and how to develop knowledge, skills, and abilities to become more future literate. The University of Minnesota School of Nursing has been a pace setter in many areas and has always had a future time orientation. The School of Nursing is a leader in the development of knowledge, learning, and service activities that push the envelope in terms of research, education, and practice. The work of the Katherine J. Densford International Center of Nursing Leadership has stimulated dialogues and discussions about the value and importance and impact of nursing knowledge and wisdom work. Past projects include sharing the knowledge of nursing leaders with the Summit of Sages initiative and the development of the Densford Center Library of Nursing Leaders. In the fall of 2018, under my leadership, the center turned its attention to the issue of nursing foresight. The School of Nursing and the Densford Center hosted an invitational summit to explore and develop the idea of nursing foresight leadership. Dean Connie Delaney and I believed that creating a Nursing Foresight Leadership Summit would be one way to support the Future of Nursing initiative sponsored by the Robert Wood Johnson Program and help nursing leaders understand the differences between change and transformation. To learn more about the Future of Nursing initiative and the differences between change and transformation, I invite you to click on the hyperlinks in this slide. You can also learn more about the 2017 Nursing Foresight Summit by reading the Harvest document created that captured some of the thoughts, ideas, and suggestions generated from a distinguished panel of nursing leaders. One of the most important outcomes of the summit was a definition of nursing foresight leadership. Nursing foresight is the ability and act of forecasting what will be needed in the future, considering emergent healthcare trends which have consequences for population and planetary health, as well as the profession's purpose, definition, professional scope, and standards of practice. So how does one begin to develop nursing foresight leadership? Let's discuss 9 principles that will help you activate your foresight leadership skill set. An essential first principle related to the development of nursing foresight is to become conscious and aware of your own personal orientation to time. Are you a being who thinks mostly about the past, the present, or future? To what degree do you engage in reflective time shifting when situations and contexts demand it? More importantly, how would you define and categorize the time perspective of your organization? Is your organization grounded in tradition, trying to survive in the present, or eager to tackle and anticipate the future? Creating the future depends on appreciating the value of innovation and design thinking. Recall Chris McGough's words from the Change versus Transformation Prime. Transformation is a creation and not a fix. Crafting a vision of a desired future requires design thinking and creativity and appreciation of the value of innovation in action. Links associated with this slide will lead you to resources about the complexity and dynamics of design required in a health ecosystem. Supporting creativity and innovation in an organization requires appreciation of creativity with a well-defined purpose in mind. The future we model in the next slide outlines the competencies and skills leaders need to support a future leadership agenda. The 5 competencies of creativity, community thinking and planning, project delivery, and storytelling are essential to a nursing foresight leadership skill set. As a leader, you must play with new ideas, work together in community, map out solutions, make solutions real through piloting and rapid prototyping of projects, and have an idea that inspires and share the learning through storytelling and communication strategies that help people understand and appreciate the consequences and impacts of emerging trends. The way to anticipate and develop consequences of emerging trends helps to exercise and develop your future literacy skills, and there are several resources that provide theoretical and practical ways to develop those future literacies. Check out some of the resources and references at the end of this presentation and see if one or more of the resources appeals to you. Plan to read 1 or 2 of the resources to discover what is involved in the development of a futures literacy skill set. There is a generic foresight process framework developed by Joe Voros, who summarizes foresight into 6 steps that include discerning inputs from environments and happenings through environmental scanning, analyzing results from environmental scanning through asking questions about what seems to be happening, interpreting the results, and posing questions about what's really happening, and then using prospection or anticipatory thinking to ask the question, what could happen and what might happen in order to discern what is potential, possible, probable, plausible, or preferred. And then backcasting from the future and posing questions in the present about strategic planning and the best course of action for an organization to take. A key, of course, to the Foresight process is the active monitoring of industry trends, forecasts, and anticipation of disruptive innovations. Many organizations do not have a process in place to actively gather information about what is next in their industry. Authors Deering, Dilts, and Russell, in their book Alpha Leadership, Tools for Business Leaders Who Want More from Life, ask the question, is your organization more frog than bat? Most people know that frogs are not very attentive to their environments. Legend has it that you can put a frog into a pot of water and slowly turn up the heat, and it will boil to death. In contrast, bats use sonar and navigate their environment by sending out signals and using the feedback to help them find their way and navigate. Fortunately, there are a great number of resources and organizations who have their eyes on the future and are systematically gathering information about hard and soft trends likely to impact health and healthcare. For example, trends, consequences, and discussions are being aggregated and synthesized by several organizations and institutes such as Shaping Tomorrow, the Institute for Alternative Futures, the Millennium Project, the Future Today Institute, the Planetary Health Alliance. To support you in your access to future models, methods, theories, and trends, I invite you to explore the University of Minnesota School of Nursing, Katherine J. Densford International Center for Nursing Leadership website, Foresight Leadership, the Future of Nursing and Health, at www.foresight-leadership.org. Consider joining the LinkedIn conversation about the future of nursing and health. Add your voice to the dialogue and discussion related to the consequences of projected trends on nursing, education, practice, and research. Some specific trends related to digital health are noted in the next slide. Health hyper-efficiency, the personalized health movement, digital peer-to-peer healthcare. Trends by themselves provide data and information. Foresight leadership includes the process of reflecting and deliberating on trends and consequences to discern logical and cascading consequences. Amy Webb has developed a 6-step forecasting model to help leaders curate trends and discern consequences. There are other ways to unpack and engage people in dialogues and organizational learning about the impact of future trends. For example, Andy Hines, who teaches in the Future Studies program at the University of Houston, suggests the following questions to engage people in dialogue about a specific topic or trend. An integral approach to considering the future involves attention to 4 dimensions: the personal, the cultural, the behavioral, and the social. Think of an emerging topic related to the future of nursing and health like data science, genetics, artificial intelligence, climate change. How can you use the questions to unpack and make explicit some of the consequences of these topics in terms of the future? Another way to engage people in thinking about the future is through games. Check out the video clip hyperlink on this game designed by a Canadian group to help people activate and develop their future thinking skills. If you are interested in playing the game, let me know, as you can check it out at the Densford Center and play with a group of friends. Trends come alive through the creation of scenarios. A scenario is a method for telling a story about the future. It can be based on reliable or speculative data. For example, the Robert Wood Johnson Foundation commissioned the Institute for Alternative Future to create and develop scenarios about the future of healthcare in 2032. The next slide has a hyperlink to the final report. Click on it and read the scenarios. Which one resonates the most with you? Which one do you think is most likely to emerge? Which one do you want to emerge? In addition to the 4 scenarios about healthcare and healthcare in 2032, the Institute for Alternative Future has other scenarios about healthcare in the future, as well as the future of human services in the year 2035. Read and reflect on these 4 human service scenarios for the year 2035. What are the implications of each of these for the future of nursing and health? Strategic conversations about scenarios like this should be organized around the following questions. How plausible does the scenario seem? What thoughts does it suggest? What feelings does it generate? What are the implications for society, healthcare, and nursing? If parts of the scenario are desirable, what actions need to be taken to increase the chances of it happening? If parts are undesirable, what actions need to be taken to prevent them from happening? Once a direction or decision has been made about the pursuit of a desired future, leaders must navigate change with the appreciation, influence, and control. The AIC model of leadership developed by William Smith is simple, elegant, and powerful. Smith observes once a purpose is determined, it sets up energies related to ideals, values, and goals. And success is achieved with degrees of appreciation, influence, and control. A leader's task is to help people compare the ideal with the reality and discern who is going to support or not support the vision into action. And then one is challenged to decide what to do about it. Successful foresight initiatives have equal amounts of appreciation, influence, and control factors. I invite you to learn more about the AIC model and consider how you can incorporate this model in your own leadership skill set. I began the lecture referencing the work of Philip and Michaela Tarlow with their observation that what the future holds for you depends on what you hold for the future. So this brings us to the issue of personal and/or professional leadership legacy. As you consider the future, considering your personal and professional past, what difference do you want to make in the world of nursing and health? What do you want to be known for? What stories will people tell after you leave your organization? What contributions will be most remembered when you are ready to retire? Create a career legacy map with the desired future in mind, and begin to exercise your foresight leadership to make a positive difference in the world of nursing and health. I hope you continue to learn more about foresight and futures literacy. Check out some of the references and resources in the next 2 slides. Visit the Foresight Leadership Future of Nursing and Health web resource at www.foresight-leadership.org. Join the Foresight Leadership Future of Nursing and Health Learning community on LinkedIn. Add your voice to the conversation about trends, impacts, consequences, and developments likely to influence the future of nursing, health, and the planet. Explore, learn, and contribute because you are the next generation nursing leaders responsible for creating the professional future of nursing and health. Thanks for taking time to listen to this lecture and scoping out the references and resources available to you. Best wishes as you continue to create and influence the future with your leadership skill set.